October is Breast Cancer Awareness Month, a time when the world comes together to shine light on a disease that affects millions of women and families. But awareness is just the beginning, because the real power lies in actions. Early detection saves lives, yet far too many women are still being diagnosed too late. Today, we're focusing on the importance of breast cancer screening, what it means, why it matters, and how it can change or even save your life. Joining us on this edition of Sources is someone on the front line of this fight, Dr. Ghazi of the Cancer Institute of Guyana. With years of experience in oncology and a deep commitment to women's health, Dr. Ghazi has seen firsthand the difference early screening can make. Welcome to Sources. I'm your host, Svetlana Marshall. Today, on this edition of Sources, we'll be talking about breast cancer, bringing awareness to this disease. This has caused many lives, but with preventative care and treatment, we could save many lives as well. So to do so with me, I have one of the lead doctors at the Cancer Institute of Guyana, Dr. Ghazi. Dr. Ghazi, welcome to Sources.
Thank you for inviting me.
Dr. Ghazi, to start this evening's program, I would like to talk about what are some of the causes. Oftentimes we talk about preventative care or treatment. We talk about early detection. But what exactly causes cancer, and breast cancer in particular?
As you know, cancer does not have a known cause in general. But yes, in some cancers, the genes is very important. And in breast cancer, 10% of the cancers are caused by genes inherited from the parents, mother or father. And as you know, cancer is a disease where the DNA in the cell is affected. So 10% that affected genes are transferred to the whoever suffers with breast cancer. But 90% of the cases, we don't know the cause, right? But there are risk factors, smoking, obesity. In case of breast cancer, if you have less children or no children at all, if you're on hormone therapy, if you're taking pills, these are the risk factors. Environment, pollution, these are some risk factors which are there. But we cannot say exactly what causes it. It is just like, cancer don't see race or gender, black, white, tall, short, whatever. It
cuts across communities.
Right, and you never know. When you're least expecting it, it affects you.
Mm-hmm. How common is breast cancer in Guyana, and what have been the recent trends you've seen?
It's very common. It's the second common cancer. 17% of all cancers in women are breast cancer, and 27% in breast cancer are like fatal outcomes.
Mm-hmm. Fatal outcomes. Mm-hmm. Let's talk about that. Why so? Is it because people detect it at a late stage?
Yes, a lot of times it is ignorance, it is denial, and honestly, when you invited me, I was thinking it's a chance to talk about what happens, when we detect a cancer in a woman, right? So, for example, my outreach clinic is on the west side, and I see these women coming from hinterlands or islands, and say, I find a mass in some woman, right? And I tell her, what, we see a suspected mass. I send her for a mammogram, which we offer at Cancer Institute, and I send her for other tests, tumor markers. When she comes back, and if I tell her that, look, there's a mass there and we want to do biopsy, for example, and sometimes you don't see them.
They don't show.
Sometimes they go, and some neighbor will tell them, look, don't do biopsy. If you do biopsy, the cancer is going to spread. Or okay, if they treat you, they will give you chemotherapy, which is very dangerous. Similarly about radiation therapy. So we lose people in the way. And
because of these misconceptions.
myths, So that's the reason that we during October we want to make sure that people know what are the hazards, what are the dangers of ignoring yourself, denying the disease, and it's cancer is preventable if you eliminate the risk factors. Cancer is curable if you diagnose it early in stages.
Let's talk first off about detection. How does one realizes that something is wrong with, for example, me? How would I know if I should come and see you?
First of all, I would stress on a point of early detection, right?
Yes,
what you're asking
definitely.
me for. Who is the first one who can detect the cancer?
Yourself.
Yes, self-examination. Women who are 20 years and older are asked to examine themselves in a particular way every month. Right hand, left breast, left hand, right breast, and fixed date on a month, like 5 or 7 days after the period starts. Women can examine themselves, applying hand on the breast clockwise, going clockwise, and if they feel a lump or something, in between the finger and the chest wall, note the position, write it down, and visit your doctor and tell them, I feel that. So it starts from 20 years self-examination. Later on, 30 years onwards, you can have a clinical examination every year or every 2-3 years by a professional, like at Cancer Institute, for example, or oncology department of GPSC. You go and get yourself examined. So this is how you detect it early. And right.
So walk me through the process. So once I decide, what I'm going to do, I go to the Cancer Institute, I'm going to have myself screened, if that's the correct term to use. Walk me through the process of going to the Cancer Institute. What happens when I get there? Do I engage in consultation? Do I have a physical examination done? How is it?
First of all, you'll be welcomed by a very pleasant staff there. Our staff is very friendly. They will, depending on your age, for example, you go there and you say, hey, I want to get a screen for cancer, or, so they will ask your age, right? And your age, you'll tell your age. Depending on your age, from 20 years, like I told you, to say 40 years, we would do clinical examination or ultrasound, okay? Because the next thing is mammogram, but mammogram is not advisable if people are younger than 40 years, because mammogram are radiations. We don't want to expose, except those 30 to 40 years who have a family history or a suspicious mass. We do that, right? Mm-hmm. So they will tell you you will see a physician who will examine you and do ultrasound and a clinical examination. And if the history, they will ask your family history. If anybody in your family had breast cancer or any kind of cancer, that's a risk factor. So from there onwards, if you're 40 years or older, if we do mammogram and we find a lump or mass suspicious, we would go for a biopsy and do the biopsy, send the sample to the lab, and if the lab confirms that it is cancer, then we go further towards treatment. Chemotherapy or surgery or hormones.
Why is screening so important? Before we go to the treatment, why is screening so important? Because sometimes I could say, I checked myself and I am fine. There's no need to come and see the professionals.
Yeah, although you'll make master of yourself on your body, but still there are things which would be so small in your breast which you cannot even feel, you cannot even see. Early detection saves life. That's the main motto. Like if we detect things early, we can save your life. For example, if you don't, say you did say ultrasound, you're young, and we see a small tiny mass, for example, or we don't see anything, and you then don't come. I went to Cancer Institute, for example, in 2021. I was fine, so I don't go. say 2024 or 23, there's something which developed after our examination, you would not know, right? And that 2-3 years of not getting a screen will make a lot of difference. You might get a lymph node in your armpit if the cancer was there and it is spread. You might get lymph nodes anywhere else in the body. Liver is a site where the cancer can spread. Bones later on. So there are stages, right?
Yeah.
0, 1, 2, 3, 4. So not screening yourself is putting yourself into danger, and it is World Health Organization and everybody in the professional world which recommends women to screen with equity. Equity means no woman should be denied, screening wherever they are living, and that's how government is now providing mammogram machines in Saudi.
The regional
regional hospitals. That's a great move. That's what WHO recommends. PAHO recommends that, especially breast cancer screening should be available equally to all populations, regardless of their status, regardless of their color, race, gender, or where they are living.
And so the Cancer Institute for the month of October, I understand, is offering
but we offered
free
quite a few mammograms.
Yeah.
The list fills quickly because there are certain time limitations. We can do such and such number of mammograms per day. So I think it's all gone.
Wow.
But yes.
But that's a good thing that people are capitalizing on the opportunity to get
hundreds of people were screened at Cancer Institute. Cancer Institute is the first one in Guyana, in the region, which has offered the radiation oncology, radiation therapy in the region. We started in 2006. Since then, although I would say we are not being recognized that much as we expect, but there are a lot of factors behind it. But we are doing a fantastic, fabulous job in creating awareness. I still remember when I used to come, I was living in America, and I used to come once in a while and do these outreaches. We would find women in later stages of cancer, and we were like, and since we started this awareness campaign, Cancer Institute has this honor to start this for this population early as 2016. So we are seeing less advanced cases now.
You're seeing less advanced cases. And that's a good thing because it means that persons are detecting the cancer early and so they catch it in the early stages.
Yes.
That's good to know. Now, once you've been diagnosed with cancer, it's been confirmed, what are some of the treatment available at the Cancer Institute and in Guyana overall?
Cancer Institute, basically, we have a chemotherapy available, hormone therapy. Our oncologists will treat patients with that. For surgery, we'll refer them to GPHC, Georgetown Oncology Department. They will manage it there. So, but main thing is to come for screening and detection. Once it is detected, there are so many outlets, where you can, so many ways to deal with it.
To deal with it. And are you seeing, you said you're seeing fewer cases of late stages of cancer, but are you seeing younger women coming forward, or this is mid-age women? Is it a particular age group that you're seeing a higher number?
We see once in a while younger people also compared to, say, 15, 20 years ago, but mainly, the risk factor increases with age. Breast cancer is a disease of women 30 plus, as the age progresses, the incidence rate progresses. 56 to 60 year, 40 to 60 year, it's more in number than the younger women. For example, these young girls get panicked and, they study a lot. Okay, I got a lump, and they lose their sleep. But most of the young women would get a benign kind of masses in their breast called fibroadenoma or fibrocystic lesions, which are benign. So the masses, the lumps in the breast are two kinds, benign and malignant. So if you have a benign lesion in your breast, that is not dangerous don't lose sleep over it. Let the professional, the specialists, the doctors who are aware, the specialists in mammogram or young people don't get mammogram, but ultrasound. When we do ultrasound, we see those lesions, and if we tell you that this is benign, and sometimes we have to do a FNA or another kind of biopsy with a needle, but 90% of the cases, more than 90%, are benign.
Okay, among young women.
Among young women.
And what about the other kind that you referenced to?
The malignant kind, we already discussed that when we find them.
The mass.
Yeah.
Okay. Now, earlier you referenced to misconceptions. You said, when you started the outreaches, women would come. I guess by now you're seeing persons from all walks of life, women from all walks of life, coming, visiting your clinic and as well as the Cancer Institute of Guyana. But sometimes some of them do not return for the treatment, and so then we lose them to cancer in some of the cases. I would really love for you to, I know that there's various options, treatments available based on the stages they're at, but help me understand what it's like to go through chemotherapy and the other treatments, cancer treatments, but also what are some of the misconceptions that must be addressed?
Oh my God, that's what I told you, that it is hard. It is something when you speak, there are a lot of people who would say, oh, you're not right, you're not correct, but I'm 100% committed to what I'm saying. When a woman comes and they go away, like I told you, if we tell them you have to have a biopsy or chemotherapy, and as soon as they go there to their home or their neighborhoods, or people start telling them what to do. Like they become the oncologist, and some will tell you, oh, I know this bush doctor, he has the treatment. Somebody say, oh, you know what, why don't you go on fruit fast? Oh, that would kill the cancer. Somebody would say, okay, there is a place where people give you water or whatever, the tumors go away, and don't go to these doctors. You see, that is the point where which actually frustrates me, because here is the research-based treatments. Thousands and thousands and millions of dollars are spread to study the chemotherapeutic agents. Which agents are acting on what kind of cancers, which will help to treat. You see, these chemotherapy agents, they act on only cancer cells, not healthy cells. There is a collateral little side effect also, but they act on, like I said, the cancer is due to the DNA, the basic unit of the cell. Its aberration, its abnormality cause cancer. So these chemotherapeutic agents, they act on the sick cells whose DNA is not good and kill them. And they actually kill the cancer, right? But if you don't do it, you say, no, you know what, I'll do 6 months. There was this lady in Mabaruma once, I still remember, and I quoted quite a few times, I have already quoted it, but this is an example. She used to be a pharmacy assistant at Mabaruma, and she was right in front of the hospital, but because there were less facilities in those days, okay, but she could have come to Georgetown, she could have come here, but her husband said, I'll treat you with bush medicine. So after a year, her cancer spread. It from stage 0 to 1, 2, 3, and when we were there, it already spread to her spinal cord, backbone. So we sponsored her, we brought her here, we did a CT scan on her, and she had a 9-year-old son by her bedside, I still remember, and it hurts me. And within 6 months, she lost her life. So these are the things which affects you. That's what we have to understand, that getting distracted by these treatments, which are not proven by any research, by any scientific reason, people go for it, and then when they come back to us, it's already too late.
Mm-hmm. I want to ask you for some stats now. On average, How many, and I guess in the month of October, being Breast Cancer Awareness Month, you probably would see a spike in the number of persons who are getting screened. But how many persons, how many women the Cancer Institute would have screened on average per month? If you could give me the stats for that, how many women they treat on average, and how many of them who probably came a little too late.
In October, hundreds of women come, right? Not necessarily all of them have cancer. You know, when we talk about this, more than, like I told you, 70%, actually 80 to 90% who are affected by this disease due to risk factors, uh, we don't detect like outrightly cancers right there. They go through this process.
Yeah.
It's very hard for me to tell you in October the women who come and how many would be diagnosed as cancer.
No, but an average, putting aside October, an average. I mean, would you be able to say?
Per year,
Yeah.
since last 3 years,
Okay.
at least 250 women. It's not me, it's the Guyana
Institute.
Ministry of Health, 264, 253 something. So average, I would say 250 women are diagnosed with breast cancer, malignant.
Okay. And I want you to elaborate a bit, because I went recently to a forum, and it was said the same thing. The woman said, you know, she was diagnosed with cancer, and she resorted to what we call bush medicine. And so after several months, she realized that, you know what, this thing is spreading. Of course, she went and checked up, and she saw that it was spreading. And the importance of not leaving it up to ourselves to treat our own body, but to seek professional help. And I think that's an important point to drive home. Once you realize that maybe something is not right,
Yeah.
there is a lump in the breast, that you seek professional help. You see the doctors, there's the Cancer Institute, there's the various hospitals, and like we said, that the ministry would have gone and they've established mammograms machine across, I think, the regional hospitals and the Georgetown hospitals. So it's important for women to seek professional help. And you do have breast cancer in men too.
Yes.
And that's something, would you?
1% of the men can get.
Do you
breast
see them
cancer.
coming to the Cancer Institute though?
Yeah, I mean, the number is not a lot, but yes, once in a while we do. There is a thing called gynecomastia where the men develop extra breast tissue. So sometimes they have anxiety about it, and they come and they want us to screen them. So yeah, at least 2 or 3 patients since the inception, male patients we have seen.
Do you think for some women, because you say some women, you know, when they hear about the treatment, they probably don't show up back. Some of them do not. Do you think cost is a factor as against them being scared?
Yeah.
Do you think the cost?
I think that's a good observation, but the other factors are more. But yes, women, you know, basically women is more sensitive, more loving than men, and more sacrificing. When some women find that they have this disease and their socio-economic situation is not very good, and they have their family in front of them, sometimes they just deny and ignore, and they don't even tell their family, you know, that they are suffering with, they're having a mass or lump, or the doctor told them that. And here I want to stress on this point that when a person suffers with cancer, it is not that person only. It is the whole community. It is the family who faces it. You know, so we have to take cancer as a joint problem of a family at large. You know, and I would recommend that family members, the neighbors, the members of the community around that patient should support, should help that individual in getting treated, getting investigated. If they see somebody is like distracting, going other way, and they know after listening to us or anybody that how important it is to screen, they should convince that person, they should bring that person to the right place to get the treatment.
You raised an important point, the importance of supporting community
Yes.
in all of this. Because sometimes if you feel as though you're alone in this battle, then they may not see a reason to fight or to live on and to seek the treatment they need.
Yeah, you see, here we are not that comprehensive in the management. In the Western world, there are psychologists, there are psychiatrists, there are occupational health people, there is a rehabilitation going on of a patient at the same time. There is a whole team which is working to help and support that individual who is suffering with cancer so he can adjust himself properly in the society and go back to the normal life as soon as possible. We need to do that to make our community, society, our nation healthy.
What more could be done, though, to help persons who were fighting cancer from a policy level? Is there any recommendations you would put forward?
I mean, like I said, the facilities should be made accessible to all classes of people, whether it is if they live in far distances, in Cameroon or in those areas in Region 1. We have to bring them to the facilities or take the facilities there. Screenings, outreaches, frequent by government, by non-governmental agencies to reach out and screen people to find or detect early signs of cancer. Not only breast cancer, cervical cancer, which is very common, and we have to do pap smear campaigns. So these things on part of the government to spread the knowledge through media, through advertisements and awareness camps, and hospitals should have a routine awareness, patient awareness meetings where they could invite the people around them or their patients who are regular there and tell them about this disease.
Let's talk about awareness and how the Cancer Institute has been bringing awareness and some of the partnerships it would have had and continues to have with various organizations and the importance of that awareness.
Cancer Institute has always recognized the efforts done by other stakeholders in the community. For example, Periwinkle. We partnered with Periwinkle Group for a long time. We partner with GPHC, we partner with the oncology department. Whoever is doing a walk, recently there are so many walks, we participated in them to make a joint movement, right? Strength is in unity. Strength is where we all join together and fight against this monster. So Cancer Institute's doors are open to anyone who can help us fight this disease.
Do you conduct, I know your clinic probably does, but does the Cancer Institute do outreaches to the various, say, hinterland regions?
Yes, we did actually before COVID. Since COVID we were not able to do that many, but before COVID for 3 years I have led the teams which have gone through all 10 regions in hinterlands, especially everywhere, to do pap smears. And what I used to do when we go to pap smear, I would carry my portable ultrasound machine and would do breast screening also. So even if we go for a cervical cancer screening, we would do breast screening also. So at least 1,000 women a year we have done in that. Recently now we are reorganizing ourselves and are about to start the same outreach pattern which we used to have. In November, first week or second week of November, we are going to have the first outreach of this kind.
Okay. Tell me a bit about the services in general the Cancer Institute has outside of breast cancer, and even including that to treat patients in general, and the type of doctors and technology available at the Institute.
Yeah, we have medical doctor, we have a physician, we have a radiation oncologist who specializes in radiation oncology and chemotherapy, and we have X-ray, we have mammogram, we have CT scan there, we do bone density there. Women at older age, they develop osteoporosis, so we do bone scans there. We have radiation therapy, as I told you.
Yeah.
These are the things. So ultrasound, we have ultrasound there. So although we are a cancer institute, but we look after all kind of things.
Okay. What message would you send to women, in particular, who are looking at this program and who may be contemplating, the government issue a voucher is $8,000 voucher. I've received reports that some women have not yet gone and uplifted their voucher. But what message you would give, what advice you would give our women?
I would talk about my personal experience. Okay, at my clinic, I would get this person coming with 3 pages of report, and comes to me and says, "Hey doc, I went to such and such lab, and I gave them the voucher. They give me this test." You understand that? Mm-hmm. Actually, when I examine the patient and see the patient, I would have done different tests.
Oh.
You understand that?
I understand.
So I don't know if there is when they give the vouchers, they don't tell them to see the doctor first. Because majority of the patient I know now, that and I'm saying it without any exaggeration, majority of the patient take the vouchers and go directly to the labs or centers who do tests without discussing with a physician or a professional nurse or something.
So it should be the other way around.
Exactly.
You should, mm-hmm.
I think that's a loophole there. So now, for example, somebody came and did these tests, but I find the prostate enlarged and I want to do a PSA, which is a prostate-specific antigen on a man. So I have to write it. When I write it, for example, if he's going to a private lab, he has to spend on top of that $10,000. Mm-hmm. You understand that? But if he would have come before, so I would have, he could have used that voucher for the specific test, which needed for that person. Mm-hmm. Similarly, if I see a liver not good, for example, and I'm a sonologist, I have a long experience of doing ultrasounds and finding these complications through my eyes. So I would be like more specific about tests, what test that person might need, right? But it's the other way around. And I think that somebody has to do something about it.
Yeah. It should be in the reverse. You see the physician first, and then
right.
You're advised as to what
right.
a test is needed. What advice you would give to women, even if they may not have uplifted those vouchers, they may suspect that there's something wrong with their breasts, but they're contemplating whether to see a doctor or not, and where could they access the services of your clinic and the Cancer Institute?
I mean, I'm here on behalf of Cancer Institute, so I would say that if they are in the town or East Coast or somewhere, they should come to Cancer Institute at Lamaha and East Street, mm-hmm. and they should call Cancer Institute before going there if these services or whatever services they are seeking. Soon the Cancer Institute might have its own lab also.
Good.
So we don't have to send patients anywhere else. Like I have lab at my clinic in the west side, so specifically for tumor markers and things where I had to send them, and other places. Sometimes I would get the reports very late when the people are suffering. So now we do it on the spot, right there. We don't even tell them to come back. They will stay there. They'll get the report. The diagnosis is right there. I practice on the west side, near Parika, but mainly I think over
Cancer
here,
Institute.
Cancer Institute is the best place to visit and see, not only for cancer, but other things also, like other ailments. We have facility to test for them.
Okay. All right. And what has kept you in this profession, treating cancer patients for so long? Why have you stayed?
I, when I start coming, I call myself more an activist rather than, so I came in 2014 to Guyana, when after several visits since the inception of Cancer Institute 2006, I was seeing people suffering. In 2014, two of my siblings died with cancer before that, and my nephew and other deaths in my family. And I decided then that I will quit every kind of other practice, and I migrated, in a sense that I'm still waiting for my citizenship. The file is somewhere, but I migrated to Guyana, and believe me, that is the most satisfaction in my life, spiritually and materially, whatever you call it. I feel so good of my decision that I came here. The people and the environment, the food. Guyana is the best. So I'm here helping people, and it gives me more satisfaction helping at the grassroots level rather than in America. I was an activist also, and I used to help organizations raising funds for cancer. I'm from Pakistan, and we have a great person there, Imran Khan, who founded three cancer hospitals by now. Sorry, three cancer hospitals, state of the art. So he's my mentor, and following it, I came here to help people with the same vigor, with the same pain, to help the people around here. And I have dedicated, I think, my life dedicated to the cause of fighting cancer.
Are you satisfied with the progress the Cancer Institute has made since 2006 when it set up in Guyana?
To be very honest, yes and no. Yes, in a sense that Cancer Institute started with the basic staff and things, but with time we grew, we developed other modalities there, we developed radiation therapy there. Right now we are working to get the brachytherapy. If you know, brachytherapy is the radiation therapy when the source is inside your body, and it is for cervical cancer. It is very important. Right now, our patients from Guyana are going to other countries. Government has to spend a lot of money, to subsidize them. But recently, Cancer Institute is trying to acquire brachytherapy, system machine, and I'm in the process, and my colleagues are in the process of raising fund for that. So the woman who is suffering from cervical cancer don't have to go anywhere else spending millions of dollars. That after that, I will say, yes, we had it in between that facility, but due to some unavoidable reasons, we couldn't continue. But right now, we are almost there.
And why no? In a sense, you said yes and no. So the no factor.
That's no part is that after the brachytherapy we acquire, we will be like the most complete.
Oh, okay,
center.
I understand.
Yeah.
Do you think that the private sector is doing enough to support organizations and entities such as the Cancer Institute of Guyana to help fight this disease?
Again, to be very honest, not really. I think we need to do more. We need the private corporates, businesses. You see, Guyana is focused by the whole world right now, and we have so many companies and corporates coming to Guyana to help in the infrastructure and buildings and material things, but people have to think about humanity. People have to think about those people who are suffering. People have to think about those cancer patients and their families who die day in, day out, suffering with pain and torments and things like that. And they have to think about them and come forward to help. For example, why we are struggling to get a brachytherapy machine, trying to raise funds. I wish there's somebody out there, he come to me or any of my colleagues and say, hey, listen, you want to treat these people, this woman who are suffering with cancer, with brachytherapy, here is my donation, just go and buy it. It's not much. It's $200,000, right?
200,000 US.
US. So, I mean, approximately. I'm not. I don't want to be accountable for the amount. So, I wish that would, or 4 or 5 companies or corporates join hands together and say $50,000, $25,000 each, and bring that thing to us, and we have the whole system set up right now. Only the thing is.
And you have people capable of operating it.
Yes. Capable, we have experienced radiation oncologists on the staff. We have physicists, 2 physicists we have. It's not like we are running something like without control. We have full quality control. We are dedicated to do this, whether somebody help us or not. But that's what we are going to do. And we'll show the people that, if there is a will, there is a way. Mm-hmm. We are going to do that. We are going to help people. And if it's not a business, it's not something, you will invest and make money out of it. It is saving lives. It is saving people.
Dr. Ghazi, finally, words of encouragement to women who are battling cancer now and the family behind those who have to give the support.
I mean, hats off to them. The survivors. Since 2006-07, I have seen a lot of survivors. I have seen survivors who survived for some time, and they were so brave, they were so strong, and I would see them and I would say they can never die, Mm-hmm. But cancer have its, repercussions later on, and I lost them. Mm-hmm. I still remember them. But this is the message to women who are suffering with cancer, that don't lose hope. Don't lose hope. Be strong. When you're depressed, when you have anxiety, when you have you study a lot, your body immunity goes down and cancer attacks you. But if you're strong and your family is strong, you can beat it. You can even, sometimes if it is early stage, you can be completely cured, right? Mm-hmm. So don't think that cancer is a death sentence. If cancer happens, you're going to lose life. But no. Come to Cancer Institute or go anywhere, screen yourself and get tested. And women who are diagnosed should regularly do their follow-ups with Cancer Institute and other places, wherever they are going. Don't lose your doctors. Don't lose the team who is taking care of you. Sometimes it happens, okay, hey doc, I'm going, I was out for 6 months because somebody told me to go to certain place, like same thing, do the bush medicine. Mm-hmm. So bush medicine is good, but along with the traditional treatment.
Thank you so much, Dr. Ghazi. And to our viewers and our women listening, do remember that cancer is not a death sentence, and that early detection saves life. And on this note, I would like to remember my sister, Svetlana Marshall, who died 10 years ago from cancer. Because at that time, there were, in her case, several misdiagnoses. And so the cancer was detected at a very late stage. But I'm thankful that 10 years after, we've seen development in this area, and major focus is being placed on cancer, and that more women are being saved and being provided with the treatment and the care they so need. And with that, I'm your host, Svetlana Marshall.